Hi everyone, my name is Megan, and today I'm going to be talking about reminiscence therapy. First of all, what is reminiscing? Merriam-Webster defines reminiscing as the process or practice of thinking or telling about past experiences or a remembered experience. By sharing memories with others, the goal of reminiscence is to increase positive feelings along with promote feelings of connectedness to those around them. Reminiscing can occur alone or in a group. It has become a common intervention in nursing homes due to the cost-effective nature and because it is a non-pharmacological intervention that can be done to help residents. The history of reminiscence therapy. Humans have always been natural storytellers, but it wasn't until 1963, when Dr. Robert Butler's article Life Review came out, that the groundwork was laid for reminiscence therapy. The premise was based on Erickson's theory of psychosocial development, where, for older people, past memories are not a negative experience. In fact, later in his life, Dr. Butler emphasized the importance of turning one's past negative emotions into positive ones in order to attain self-integrity. Between 1994 and 1995, reminiscence therapy really took off and became part of the field of standard nursing practice. The American Nurses Association further defined the role of reminiscence therapy in the regulation on the amendment of the nursing regulation from April 19, 2011. So the good thing about reminiscence is that anyone can share memories. It's a versatile activity that can be performed as an intergenerational activity. It can be done between family members even. Reminiscence is particularly beneficial to older adults, and the intervention is common in long-term care facilities for reasons we'll get into in the next few slides. In a facility, reminiscence therapy can be performed by many staff members, recreation therapists, obviously, but also nurses and doctors, physical, occupational, and speech therapists, and even administrative and ancillary staff members. Again, anyone can participate in reminiscing. The outcomes of reminiscence therapy are that it is especially helpful in treating dementia and depression. Additional benefits of this intervention are improvement of self-esteem, reduction of unwanted behaviors, decreased levels of stress, an increased sense of well-being and feelings of joy, increased quality of life, and it aids in the acceptance of current conditions. Reminiscing therapy also provides a good chance for connection and bonding with caregivers, family members, and peers. Getting to know people and allowing them to share their story creates connections, which can really go a long way in helping people feel seen and understood, especially when they live in a facility. In terms of research on the efficacy of reminiscence therapy, there are four particularly interesting studies that I looked at. The first is called The Effectiveness of Group Music Reminiscence Therapy for People Thriving with Dementia, a systematic review of randomized controlled trials. This study found that reminiscing through music was effective in temporarily improving levels of cognition. It also found that reminiscence therapy is effective in relieving depression related to dementia. In the study, The Effect of Group Reminiscence on Death Anxiety and Adaptation of the Elderly to Old Age, the authors split their cohort of participants into two groups. The group that received reminiscence therapy saw a decrease in the level of anxiety they felt related to death and the dying process. There was also a noted increase in the ability to adapt to the effects of aging. Meanwhile, the control group did not see changes in either category measured. In The Effect of Individual Reminiscence Therapy on Adaptation Difficulties of the Elderly, a randomized clinical trial, Kaplan and Kessler found that participants who received weekly in-home one-on-one reminiscence therapy saw a decrease in difficulties with adapting to the effects of aging. Finally, in Reminiscence Intervention for Community-Dwelling Older Adults Without Dementia, a literature review, they analyzed many studies related to reminiscence therapy and found that adults without dementia saw improvement in many areas related to depression, well-being, peace or life satisfaction, quality of life, social engagement, anxiety, and cognitive or memory abilities. The literature very clearly supports reminiscence therapy as an intervention that is useful when working with the elderly. When it comes to guidelines for providing reminiscence therapy, remember that you can reminisce about really any topic under the sun. The questions you ask should hit on memories related to people, places, experiences, along with the five senses. Reminiscing can be done one on one, in small groups, or in large groups. You facilitate the session or the group by asking open-ended questions geared toward reminiscing. You need to actively listen and ask follow-up questions related to the answers your participants are giving, as this shows you're attentive and engaged in the conversation. You should always ask at least one question that's relatively easy in order to get as many participants answering as possible. Not everyone will give an answer for every question, so you want something pretty low ball. For example, if you're reminiscing about summer, what's your favorite flavor of ice cream? If you're reminiscing about Mother's Day, you can go around and ask everyone to share their mother's name. They're simple questions, but will get people engaged in the conversation. You really need to tailor your topics and questions to the population you're working with. You wouldn't ask a group of seniors if they've ever seen Ariana Grande in concert, but you might ask them if they've seen Sinatra or Liberace. At the other end of that, you wouldn't ask a group of teenagers what it was like during World War II because they weren't around then. Your topics have to be relevant to the population. Lastly, make sure you have enough questions to fill the time. You want to have more questions than you think you need because you never know which questions might be hits and which might not garner much response. So having more than enough questions ensures you have enough content for your full reminiscing time. In terms of risk management, make sure no one is being pushed to share anything they don't feel comfortable sharing. You need to keep the reminiscing space safe. You also need to remember that reminiscing can bring up negative memories and feelings. It's unintended, but it does happen. Not everyone's lived a happy life, so certain topics or questions can make things bubble to the surface. It's important to validate the experiences people had and the very real feelings that they still have because of it. In extreme situations, someone may not come to an activity at all because they get upset by it. I have a resident who comes to nearly every activity, but she had a difficult childhood, so she chooses not to come to reminiscing group when it has to do with reflecting on experiences from childhood. Discussing adulthood is easier for her, but she still prefers not to participate at all. Other times, someone may become upset during the activity and need to leave, which you also need to honor. Avoid questions about controversial topics if at all possible. There is already enough division in the world, and the goal of recreational therapy is really to bring people together in a positive way. Lastly, if you're reminiscing in a group, try not to let any one participant dominate the conversation. There will be people who are naturally quieter than others, but you have to make sure no one is drowning out the others who want to contribute something to the conversation. When it comes to reminiscing ideas, remember that reminiscing can be done in many ways. It can happen in general conversation, either one on one or in groups. Reminiscing can be done by baking and cooking. You can reminisce while having an animal encounter. You can reminisce through music or sensory stimulation. Watching videos and looking at pictures also stimulates memories. Technology can also be a great way of reminiscing, as you can use it to enhance the experience. Augmented reality and virtual reality can immerse participants in scenes that bring back memories. You can look up information about a company that a participant used to work at. You can use a genealogy website to help them research and reminisce about their family trees. The options are truly limitless. A more in-depth reminiscing activity would be something like a Thanksgiving reminiscence group, which I held just this past week. First, you gather the group. Then you ask questions related to the topic of conversation, in this case, Thanksgiving. Sample questions include: where did you go for Thanksgiving when you were a child or as an adult? What is your favorite Thanksgiving food? What special desserts were served at Thanksgiving? Did you ever go to a restaurant for Thanksgiving dinner? What was that experience like? Do any of you enjoy watching or playing football on Thanksgiving? Did you ever have the weather ruin your Thanksgiving plans? Based on the answers you receive, you would ask further questions and build off the conversation. So here's a full week of reminiscing activities. I did 7 days worth of activities because in my facility, we usually have at least one activity every day of the week. That's going to vary depending on where you work. On Sunday, there's reminiscing through music, which hits on the cognitive, social, and even physical domains. Using technology, you play music that the participants want to listen to from their favorite artists or movies, discussing their choices between songs. It can become a physical activity if the participants get really into it and start dancing. On Monday, there's documentary and discussion, a cognitive and social activity. In this one, you would watch a documentary about pertinent time period or person or event. Then you would ask questions to discuss what they remember about living during that time period. A good example of this would be a documentary and discussion themed around Veterans Day. We would watch a documentary about one of the wars we have fought and then follow up with questions about what it was like living during that time period or even serving in the army. On Tuesday, there's Community Cafe, a social and spiritual activity. Gathering in any space that holds several people, coffee and treats are served. The relaxed coffee house setting creates a cozy place for conversation to naturally take place. Ask participants questions so they can get to know one another, fostering a sense of community. On Wednesday, there's Thanksgiving themed reminiscing group. That's a cognitive and social activity where you discuss questions related to the theme. On Thursday, there's exercise to music or jazzercise. This is a physical activity where someone leads an adaptive chair exercise class while upbeat music from the 50s, 60s, 70s, and 80s plays. Physical activities are not always the most popular ones, but you'd be surprised by how many people are willing to come when they know they might get to hear a song they haven't heard in a long time. On Friday, there's reminiscing through baking, an activity that is cognitive, physical, and social. When you gather your group to bake any kind of recipe, the actions, smells, and tastes bring up memories for those who used to do a lot of baking and cooking. Finally, on Saturday, there is movie matinee, an activity that is mostly passive leisure but does have a social component to it. By picking a popular old movie or a movie with a popular actor from back in the day, you can generate a conversation that way. Announcing the movie early in the day can get residents talking, creating a natural reminiscing moment as they consider other movies they have seen similar to it or starring those actors. And this is just my reference slide. Thanks for watching.